Alright then. So I got a request from someone to do a med talk on abdominal self-diagnosis. Well, first of all, self-diagnose in itself is just extremely dangerous because you just don't know about stuff. Don't underestimate us medical people because we have been studying for years. And as you know, most of the time we don't even know what the hell's going on with your body. So instead of encouraging you to take matters in your own hands, I'm just going to walk you through what a doctor actually thinks whenever a patient presents themselves with abdominal pain. So we usually start out with a history. When did the pain start? Where is it? If it starts here, does it sometimes radiate to other places, to your back, to your shoulders? Are there certain things that make the pain better or worse? And you can think about food, but also medication, exertion of the body, or perhaps after you defecated, does it get worse? Does it get better? There might be other symptoms like fever, a change in weight, nausea and vomiting, diarrhea, or constipation. You can actually have blood that you vomit up, or it ends up in your stool, or you can have jaundice or a change of color of your urine or your stool. Symptoms that most people usually don't have, so be thankful for that. Then we want to know about your past medical history, perhaps also the medical history of family members that are close to you, your alcohol intake, medication, and for the ladies, a gynecologic history. Okay, so we've done that. Then for the physical examination, we always start with the same things, the vitals. The vitals are, well, are you not dying on the spot right now? Blood pressure, the pulse, and your temperature. If something's going on within those parameters, there's probably something really going on. So then we check your eyes and skin for the color, because if you have jaundice, that is the part of your body that actually ends up yellow. So we check your lungs, we check your heart, and then we end up with your stomach. So what we usually start out with is just the listening. So what we do is we just go around a little bit, and what we want to hear is, basically your intestines doing their work. If they're not doing their work at all and you hear nothing, you're probably already dying of pain. And if we actually hear a lot of bowel sounds, that's not always a good sign either. So after we do that, we do the palpation of the abdomen. What we do is we feel in your abdomen and see if we can actually feel any kind of masses. It could be a tumor, it could also be, stool stuck in your intestines if you have obstipation. We want to know if it's actually tender or painful if we touch somewhere, which could be a sign of infection, and some kind of signs of peritoneal signs, which basically means that if your whole stomach is reacting to me touching it, there's probably a lot of stuff going on there that we need to get checked out. And then the rectal examination and the vaginal examination is just part of a physical examination, and though it may be a little bit awkward for the both of us, it needs to be done. So what is the differential diagnosis that we work with? We basically split abdominal pain in acute abdominal pain and chronic abdominal pain. Acute abdominal pain, if this happens to you, you probably won't have time to watch this whole video, you just need to go to the ER. So we got a couple of possibilities. First of all, the surgical abdomen. Surgical abdomen basically means that you got something so bad going on that we really need to operate it as soon as possible. This could be an obstruction of your intestines or a peritonitis. Your peritoneum is basically a fleece over all your intestines and other organs, and if that gets inflamed, it hurts basically everywhere. So then we got the right upper quadrant pain. Most of the time it's gallstones, but if gallstones stay there for a very long time, you could actually get inflammation over there. It could be a cholangitis of the gall ducts, or it could be a cholecystitis, an inflammation of your gallbladder itself. Then you have the epigastric pain. Right in the middle, it could be a sign of acute pancreatitis, hepatobiliary pain, but most of the time this is where your stomach pain originates. So if you have stomach acid, that sort of stuff, is something that doesn't really ends up sitting well with you, and you end up having an ulcer in your stomach, this is where the pain gets, right in the middle. Then we go a little bit lower to the lower abdominal pain. This could be a part of your distal intestinal tract, which means the great intestine, the rectum, that sort of stuff, which could get inflamed. You could get colitis, diverticulitis, that sort of stuff. You could have inflammatory bowel disease with a lot of acute symptoms that usually affects your great intestine. And it could be colon cancer. Most of the time it isn't, though. Well, then we got the gynecology path, the pelvic pain, which could be a lot. It could just be a painful menstruation, it could be ovulation pain, it could be pregnancy, it could be ectopic pregnancy, it could be a miscarriage, it could be pelvic inflammatory disease, it could be a kyst, it could be the bleeding or the torsion of an ovary, it could be an infection like endometritis, or it could be a leiomyoma. We women have it bad. Let's get really honest with that. And then you have just generalized abdominal pain. Once again, it could be the surgical abdomen because that tends to be painful everywhere and all the time. It could be an infarction of one of the blood vessels that actually gives blood to your organs. Most of the time it's mesenteric ischemia, which is quite rare. So most of the time it's a gastroenteritis or, food poisoning. It's just a temporary thing. It'll be over in a couple of days. It could actually be a sign of an underlying metabolic disease. Who knows? I sure don't. And let's just think about acute abdominal pain that doesn't really have an abdominal cause. It could be a cardiac cause. A myocardial infarction can actually spread out to your stomach and you wouldn't know. Or it could be a pleural or a pulmonary thing. Think about a pneumonia, which is only part of the lower lobe, so you end up having more pain in the stomach area rather than up. Or it could be renal. You can have renal colic stones, basically like gallstones, but a little bit lower. You could have one of them lady problems. But acute abdominal pain is usually something that people recognize really quickly, and you'll get treated in no time. But the chronic abdominal pain is really tough because most of the time you really can't find a cause for what is ailing you. Well, first of all, it could once again be a stomach acid problem. You can have an ulcer, you can have reflux problems, and most of the time with medication, we are able to kind of slow it down a little bit. It could be chronic pancreatitis, and this is usually with people who have either metabolic disease apart from that, or they just drink a lot. The discussion about celiac disease has been really popular lately. Apart from celiac disease, which is based on the fact that you're intolerant for gluten, people believe that apart from having celiac disease, gluten generally just is really bad for you because as the human race, we're not properly developed to digest it, apparently. So that could actually be just a tip, if you find out that you have a lot of stomach problems and there's no cause for it, try taking out gluten in your diet or lactose, or get an allergy test with your physician and see if anything comes out of that. Inflammatory bowel disease is an autoimmune disease where you actually end up having a lot of inflammation in your intestines. It could be Crohn's disease or ulcerative colitis, but you should have a lot of stuff going wrong with you. You should have fever, you should have extensive vomiting, blood in your stool. Like most of the people don't really end up having that. What we usually diagnose with people who have a lot of stomach pain without having an organic cause that we can find is irritable bowel syndrome. It basically means that sometimes you have obstipation and sometimes you have diarrhea and anything in between. Sometimes you have a little bit slime in your stool but never blood. And you usually find that after you finally manage to go to the toilet, the pain subsides. And anything else? Well, we just call that functional abdominal pain syndrome. So if you actually end up in that group, that's pretty tough. Painkillers, 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 and basically the basis of not having abdominal pain is a good diet and no stress. So it's actually a miracle I'm so healthy, to be honest. Okay, so I hope this was somewhat helpful for the people who wanted a video like this, and if you have a request for another Mat talk, let me know.